Um, we'll be able to go a little bit slower and be able to show a little bit more of what's happening here. You know, one of the things we want to definitely do is just touching the tissue. Now, what does this tell you? How many of you can see this little bit of swelling here and here? Those are kidneys that are swollen. Okay, and that's just due to the food. And so what would I expect? If I start to do this on nerve tracts, how many of you can see that reaction? That's facilitation, right? So what facilitation means is that the threshold of firing of the nerve is low, meaning it just takes a little stimulus to fire off, you know, an action potential. So that's the first thing. I'm just doing this assessment. Oh, I got some swelling there. That's nutritional stuff. I'm going to go ahead and pick this dog right off the ground, and I'm going to go ahead and start to move this. How many of you can see that on the right side this moves and this doesn't want to move? Okay, just doesn't want to budge. Budge, no budge. Okay, so I'm just going to go ahead and see if we can just hike this dog out, and I'm going to put a stretch on what? Iliopsoas. I'm just going to go ahead and see. It's given way, but as soon as it gets too far, all of a sudden he's like, oh my gosh. It's like, whoa, it's putting a stretch. Oh, it's putting a stretch, especially one on the left side. He's hiking his left side, and he keeps pulling the left side first. So we're just going to keep doing that. And I'm going to just see if I can open the system up. And you can see he's way willing, right? And it's just that it's contracted. And he's low man on totem pole, right? He's got some big dogs out there. So, okay, pretty good. I'm going to go ahead and motion emphasis on the left side just because there's no movement there. And I'm going to take my thumb and I'm going to use this as a lever underneath. And my thumb is going to be on the spinous. And motion, motion, motion. Motion, keep motion. I'm just going to see if I can get this unlocked without putting a direct thrust in there. Can everybody see how free this is to this side? This side what? Not so good, right? Bingo. I'm going to go ahead now and start to move this. Not great, but starting to move a little. And I'm just going to really work that. See if I can get the... How many of you are starting to watch that move now? There you go. I'm going to go right back after I do that, and I'm going to put a stretch on the system again. Wow. Okay, really, really good. I'm going to go do the digits. You just take the heel, or your thenar, flex the digits, grab them with your fingers, and roll them. Just take this, traction, 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 traction. Those are all clear. Same thing here. Traction, 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 traction. Got that. Got to check the knee. This is called the hock. Just flexing that. Good range of motion. It's lateral, medial. It's good movement. Checking the knee. I'm going to use the hock as a lever. I'm going to put my finger on the knee, and I'm going to just check that this is all moving really good. These can get jacked up pretty good on certain dogs, smaller dogs in particular. So that's all moving really good. Going to flex the hock, really good, medial, lateral, and then I'm going to use this as a lever to check the knee. I'm rotating, rotating, that's really, really good. I'm going to go ahead and motion the PSI. First I'm going to, so this is a PI ilium. This is very pronounced, and this is very palpable. This is way AS. And I'm just going to get right on there with the heel of my hand and drive that. Good. Now it's really starting to open up. How many of you see how much more lateral flexion there is there? Now, done all that, back and cycle this again. Just keep introducing motion to basically show the body, show the brain that, hey, this is all moving. Really, really good. Traction them again. Really good. Like that, make them hang out there. I usually address this anticlinal vertebra. I just check it. You'll mistake it for an anterior segment, but I still get underneath of that to just lift that. And you've got the barrel. You take your hands on the barrel, you rock the barrel side to side this way to just make sure it's free. This is very, very free. Good, but when you do get a barrel that's stuck, you'll see that, okay? And the whole thing will just be stuck to one side. And you're gonna just grab the whole thing and boom, you just gotta swing it. And they can be really big. So this is becoming like a puddle now. I'm gonna go ahead and sit Dino down. I'm gonna take the legs up and we're gonna open him up. And most of these other dogs would have done this. The other dogs would have done this. And had I been by myself, but in this environment you wouldn't expect that. So just open this up, the central nervous system really settles. We're just going to go ahead and take this shoulder. We want that. My thumb is right on the humeral head. I'm going to flex this. This is a full range of motion like that with no pain. That wrist should flex totally like that. That elbow should flex and you should be able to just tuck that up like a chicken wing. This is really good. Just check the digits. All clear. Check the other side. Motion, flex the wrist, traction. This is cycle the shoulders, and we're good to go there. I'm going to just bring the head up, and I'm just going to slide my fingers down along the occiput, and I'm just going to feel for which atlas hits me first. This happens to be right smack on, so really, really good. This is a normal range of motion for a dog. You want to be able to see that. This morning we could, where he was stuck way down here, right? That's as far as we could go. The reason for that is the fifth cervical was posterior, and that was locking out this action. So as this moves back, you won't be able to extend your neck. So this is all good. Traction, right lateral bending, really good. Left lateral bending. On this side, my thumb is on the lamina pedicle, and I'm using that to motion all the way down into the neck. Really, really good. I still have to check the withers, and for that, and I didn't do it with the other big dogs, but basically I'm right down here with my head, my thumb, my knuckle, and I'm motioning all the way down. Once I hit the anticlinal vertebra, I'm P to A, and I'm going to motion all the way down into the lumbars. And good job, Lino. Good